Good afternoon, everyone. Good afternoon. Welcome again to our family meeting. This is our support meeting for today. And so, my name is Craig. For all those who don't know my name, who I am, I am a recovery coach here at Capital Recovery Center. And so, like always, we like to bring some informative information dealing with recovery. And so today we're going to bring an article. I'm going to share an article. This article comes from lakeviewhealth.com. You can go online and look this article up. It's brought to us by lakeviewhealth.com. All right. And so the title of this article is The Benefits of Family Support Groups During Addiction Treatment. All right, we're going to talk about some of the benefits. So let's do a little house cleaning. When I say house cleaning, I just want to bring to your awareness that May is Mental Health Awareness Month. Okay, May is Mental Health Awareness Month, and I have a flyer here that was given to me, and I would like to share it with you. And it is in the same breath of remembering the importance of mental health. And so this flyer, which I have here, it says Wear Green Day. So on May the 31st of 2024, that's on a Friday, right? This article was given to me as an employee, and it talks about green as the official color for mental health awareness. It symbolizes renewal, hope, and vitality. When you wear green, whether it's a complete outfit, a simple green awareness bracelet, or even light up a building, you're showing unwavering support for mental health. By joining the Be Seen in Green Challenge, you're not just wearing a color, you're shining a light of hope and support for millions of people who may have experienced mental health conditions. All right. And so the article goes on to say we are encouraging our community to join us and acknowledge the importance of mental health awareness by wearing green on Friday, May 31st of this year, 2024. All right. And so please be mindful of that. If you can remember, wear green on May 31st in support of mental health awareness. All right. We want to share our light of hope to all those who are dealing with mental health and those who are overcoming mental health challenges. All right, let's get into the article. Let's get into it. So we're going to talk about the benefits of family support groups during addiction recovery. This article starts off by saying addiction is a chronic disease that is characterized by the prolonged, repeated misuse of substance despite negative consequences. Physical and psychological dependence are key features of a substance use disorder, better known as SUD, S-U-D. Unfortunately, the negative consequences of addiction are often not limited to the substance's user. It can affect family, friends, and significant others too. The U.S. Surgeon General emphasizes that many people are able to make the behavioral changes needed to maintain recovery, especially with healthy and supportive social networks and recovery supportive environments. It is important to acknowledge and address the impact that addiction has had on you as a member of this supportive social network. You may feel fear, anxiety, anger, guilt, and you may have experienced physical or emotional abuse. Substance use disorder has lasting effects on those who love the person misusing drugs or alcohol the most. Spouses and partners of those addicted to substances are particularly vulnerable as they are often the ones trying to cope with and compensate for many of the negative consequences of addiction, including financial, legal, and social problems. They may also be trying to protect their children from these consequences. Those married to or in long-term partnerships with those with SUD may feel as though they have lost their significant other and that they too have lost an important part of their social support network. It is important to remember that you are not alone. Despite the isolation often associated with addiction, as a spouse or partner, you can also access support. This can be in the form of therapy, support groups for spouses of those with SUD, and other treatments. All right? And so let's go on to the first topic that we want to get into, and that is what are support groups? Support groups are a way to bring people who have shared similar experiences and who are facing similar challenges together. By sharing in a safe, non-judgmental environment, spouses and partners of those with SUD can offer compassion, support, and comfort, encouraging those facing similar challenges. They can expect the same from other members of the group. All right? So it says, what are support groups? It can also be a resourceful way to find helpful, practical, and relevant information. Medical practitioners may not be able to provide the emotional support you may require, while friends and family may not truly understand the challenges you face. Support groups can bridge this gap and offer a safe place to share feelings and experiences, healthy coping strategies, and learning or information resources. Remember, substance abuse is not an individual disease. It is a family disease. And we have to stress the point that not only the person who are indulging in the substance use disorders are affected, but also those who connected to that person. All right? So that's why we're talking about the importance of support groups. All right? So let's go on and talk about benefits of support groups. Okay? To be able to share feelings and experiences in a safe and supportive environment can be healing in and of itself. Each person will join a support group with their own goals in mind and will have their own experience. Despite this, many people report similar benefits of support groups, including, now we're talking about the benefits. We went over what a support group looked like, some of the entities that play a significant part in a support group. Now we're talking about some of the benefits of a support group, and I'm gonna go over several bullets that's listed here. Number one, it talks about reduced feelings of isolation. All right, we're talking about the benefit. It helps you to reduce feelings of isolation and loneliness. All right. Two, having a place where you can talk openly and honestly without feeling fear of judgment. Three, reduce anxiety, depression, fatigue, and stress. Four, finding new coping skills, mechanisms, and strategies, and improving these. Five, staying motivated, right? Staying motivated, encouraging yourself, be positive, all right? Six, feeling more empowered. Seven, gaining a sense of hope and control. Eight, learning about addiction and its treatment. Number nine, improving your understanding of SUD and co-occurring illnesses. That's for those who may not know what co-occurring is. Co-occurring is a dual diagnosis that one has been diagnosed of having not only substance use disorder from alcohol or drugs, but also has been diagnosed with a mental health component. All right, and so therefore, that is very important as well. You can't treat one without treating the other. And so a lot of people have been diagnosed, and a lot of people have not been diagnosed, and so they may not be aware that they have this co-occurring component that they need to address. And finally, number 10, we talk about the benefits, all right, of support groups. Number 10 says sharing helpful and practical resources. So these are 10 benefits that one can utilize in a support group, or you can gain, or you can be a part of 10 healthy benefits of support groups. So now we want to talk about or touch on how to get the most out of a support group. All right? Remember, May is Mental Health Awareness Month, and so support groups are very helpful as well. All right? And so how to get the most out of a support group. This article goes on to say many people feel nervous about joining a support group. There is the unknown aspect of who is in the group and how you will be received. All right, skepticism. All right. A lot of times people are a little apprehensive because you never know what type of crowd or audience or what is the vibes that you may get from a support group. And some people can be very intimidated, and some people can be very loving. So that's up to the individual to find out what's best suit them as their comfortability, and hopefully that you'll find a support group that is tailored to your needs and address the issues that you hope to address with some positive results and outcome. This article goes on to say, if a person is not familiar with the group dynamics or is apprehensive about sharing personal experiences, this can place them under significant strain and cause anxiety. This is normal. This article says that is normal. Everyone has that going into a support group. You're not alone, all right? One way to combat this is to listen at first. Get a feel for the group, and when you feel ready, share your own thoughts and experiences. You will get the most out of a support group if you both listen and actively share. All right, so there's a two-way street. All right, first of all, you listen, then once you feel comfortable from what you are gazing from the audience, then you may build up the confidence to share, right? Because a lot of times, unbeknown of a lot of us, when we share, we are helping someone in the process, unbeknown that someone may need to hear what you have to say and how you dealt with the situation, and hopefully they can grow and gain some insight on how to approach their situation as well. Always remember, every situation is not the same, and we may have similarity, but sameness is not so. All right? There may be likeness, but the exact identical thing has a lot of intricate details. All right. So the article goes on to say it is important. It is also important to remember that not all support groups are the same. If you feel that a particular group isn't a good fit for you, that is fine. Try to find a group that you resonate with. Of course, no group is perfect. So try a group for a few weeks before making a judgment. Remember that support groups are not a substitute for group therapy or other medical treatment. Let me read that again. The article says, remember that support groups are not a substitute for group therapy or any other medical treatment, right? This is a support group. This is not a therapeutic group. This is not a medical treatment group. This is only a family support group to give you some information and to help one another grow and build together. All right? And so it says, by joining a group, it says this certain groups for specific such as alcoholism or stage of treatment, such as withdrawal or remission. So this article says certain clinics, right, suggest asking these questions before joining a group. Is this group for a specific such as alcoholism or stage of treatment, such as withdrawal or remission? Ask the question, is there a set number of meetings or does it meet indefinitely? Ask the question, where does the group meet? Ask the question, when does the group meet and how long is each meeting? Is the group free? If not, what is the cost? Is it run by a moderator or facilitator? Ask the question, what training and experience does the moderator or facilitator have? For example, some groups are run by facilitators who are social workers or psychologists. Ask the question, what are the rules for confidentiality? This is very important because a lot of times you don't want to share some personal information that people would take and run and take outside the support group. Once you establish that what says in the room stays in the room, it gives you some comfort to know that that is the goal and that is the hope that whatever you share in the room stays in the room. Okay? Trust is very important. Let me say that again. Trust is very important when it comes to healing and receiving treatment because people want to feel and know that they are in the best hands when they come amongst you and they rely upon each other to be trustworthy. All right? It says, does the group have established group rules or a group contract? And how is this enforced? And so if you've never been in a group setting, most oftentimes, these are some of the things that a facilitator or moderator, well, I would say facilitator, I know much about facilitating, but as far as moderating, that's different from what I'm familiar with. But a facilitator would normally set ground rules or group rules, okay? And so that is to keep the group focused on the material and what's being said so that everyone is being respected and heard clearly, right? So, and the last one says, what is a typical meeting like? So you must ask these questions. So very pertinent that you ask these questions when you are looking for a support group, all right? Number one, it says, listen first, survey the area. Once you feel comfortable with the group, then you might want to share. Find out some of the ground rules. Find out if it's a confidentiality group. Find out if there's rules. Find out, how long the group lasts, et cetera, et cetera. These things one should ask because you don't want to just go into a group. I want to say flying off the lip. All right, you don't want to go in there just flying off the lip, and your business is out in the street, and there is no family or tight knit family environment. Right, so you want to check it out. Let's leave it at that. All right. The next part we want to talk about spouse and partner support. All right, at Lakeview Health. All right, so this article comes from Lakeview Health. And so, but we want to talk about what the article is talking about. This is some of the things that Lakeview spouse and partner support, right? And it says research has shown that. Let me do this. Let me do this. Okay. Let's do this. Get rid of that. Bear with me one moment. For some apparent reason, let's do this. Now we're talking. Say now. See that? Spouse and partner support. Let's talk about spouse and partner support. All right. And this can be at most support groups. And it talks about research has shown that spouses and significant others experience the benefits associated with joining support groups mentioned above. They learn healthier coping strategies, have a better support structure, and develop a sense of community, right? Studies also show that the person with the SUG also benefits from their spouse or partner seeking help and being involved in their treatment and recovery. The benefit of including family members in treatment for addiction include, we're talking about the benefits again, right? And it says reduce rates of relapse. That's very important. So that's why it's always important that, remember I said addiction is not just an individual disease, it is a family disease. So when we all come together with support, fighting this thing together, we better understand what your loved ones or whoever it may be is going through, because now you have insight of how to help them get through a lot of barriers and obstacles that they may be facing. So by doing that as a family unit, the benefit is to reduce rates of relapse, better rates of successful recovery, less time in the hospital, better mental health, decreased rates of incarceration. When your partner spouse enter treatment, the patient as well as their family and loved ones, family members will receive a support and resource to encourage them, become educated about the disease of addiction, attending phone session with the patient primary therapist and following their recommendations. These are some good tips. Participating in a 3-day family workshop and family therapy program. And so these are some of the things that when people go into treatment or support groups, they are engaged oftentimes with the premise of letting the family partake in the information, because the information is so key to helping not only their loved ones but also themselves. Okay, So there is a process most facilities go through when it comes to treatment, residential treatment. And so a lot of times people go through what is known as orientations. Sometimes there is a 3-day workshop, but this article says our 3-day workshop is based on the most current evidence-based practices in the science of addiction recovery. Wow, that is so important. Evidence, evidence-based practices. And by that, they're saying that the information that they're providing to your loved ones and to you has been tested and proven and has brought about positive results. And so therefore, they count on the information to bring about best results for you and your loved ones as well. So this is brought on by a intricate group of people who are in the medical field, the science field, the psychological field. All that good data has been proven that it works. The main thing is you want to get results. Let's just cut through the chase. The main thing is you want to get the best result for you and your loved ones. All right. So it says the core of the program is rooted in family system theory. The core of the program is rooted in family system theory. All right. Excuse me. This article says the first day revolves around psychoeducation, giving family members information about the nature of addiction as a disease. Abstinence-based recovery and effective communication are discussed. These are some key components what take place when you go into an adequate or into a support group. All right. So, because we're talking about the benefits of family support groups during addiction treatment, right? And so it says the facilitator explained family system works, what roles different people fall into in this system, and educate on codependency and addiction, learning about setting healthy boundaries and how to put these into practice and a core component of the workshop. Participants in the workshop get to share their experiences in a safe and supportive environment. Family members and patients have the space to share their feelings and experiences openly, right? The goal is to start rebuilding trust. That word. The goal is to start rebuilding trust and healthy relationships. It is also a way to learn about continual support after the patient leaves treatment. It might be the first time that spouses, partners, and family members encounter group therapy. Although support groups are not substituted for group therapy, it is a good model for what to expect in a group setting and what a group support group can feel like. And so this article is basically telling us that, you know, when you participate in your loved one's treatment during addiction treatment, after they leave those treatment facilities, you have a greater understanding of what to expect when they follow through a support group setting, because now you know that abstinence is very important, the family theory is very important, and the structure of the support group are very important. All right, and so that's all that I want to share on that topic. The benefits of family support groups during addiction treatment. Remember, Addiction is not an individual disease. It is a family disease. All right. We all are in it together. And so stick together. Do not abandon ship. Stay the course. And remember, May 31st of 2024, we asking everyone, whoever you may know, if you are in support of mental health awareness, we asking that you wear green. It's better known as Wear Green Day. I'm going to wear green, and so I'm asking that you wear green. All right? And until the next time, take care of yourself, stay healthy, love on each other, and be safe. Take care.